Good morning, everyone. So I'll be talking on flipped classroom model that we do for our fellows. So say 4 or 5 years back, when we make a monthly schedule, most of it were traditional didactic lectures. So and for residents, either we present or we ask them to make a presentation. And when we ask them to make a presentation for a 1 hour class, they'll come up with a 80 PowerPoint slide PowerPoint presentation, which is again a cut paste copy of a PDF or a copy of a slide share. And these were the two outcomes. Either most of them will be sleeping through it, or some will be busy taking notes, which they will never read it again. And this current generation, we don't see them with pen or paper. They just take notes with stylus and iPad and tablet. I'm very paranoid when they use that, because I don't know if they are taking the notes or they're going through any of this. And again, even if they may be a sincere student, the social media is so intrusive that it keeps popping up. The notifications keeps popping up and it keeps distracting them. For my teacher, when they were taking classes, they had only two concerns. One, they should not make me sleep. And two, they should not make me snore that I disturb the class. Whereas for me as a teacher, I have to compete with Netflix, I have to compete with Amazon Prime, I have to compete with Facebook, I have to compete with Twitter. And I make sure that they are listening to me and not to all these things during the class. And with the AirPod, we even don't know whether they are wearing an earphone or not. And say you have the most sincere student who listen to your class thoroughly. At the end of 2 weeks, he is going to remember only 5% of that lecture. So what is the other option? The flipped classroom, wherein preparatory material is given to the student prior to the class, either in form of a presentation, a video, or a quiz. The student goes through it at his or her own pace, at his or her own convenience, comes to the class prepared, and we engage them with active discussions during the class, and post class we give them some reading material. So from a teacher's perspective, there are three parts. We have to prepare introductory presentation in the form of a PowerPoint presentation with an audio or a video file, or a quiz, or a review article. And in the class, we will have either small group or large group discussion. And post class access, we usually give them a review article or a book chapter to read. So the pre-class preparation was the most difficult thing pre-COVID. Like when we tried flipped class 4 or 5 years back, creating this, because it's easy for us to create a PowerPoint and present, but create a PowerPoint that is self-explanatory, or create a PowerPoint and add an audio file and create it to a video and send it to them. Because when we gave the review articles for them to read, none of them read and came to the class. So then COVID happened. During the COVID wave, there was immense outpour of teaching classes and CMEs and webinars and Zoom recordings in YouTube. So post-COVID wave, we don't have to create, we just have to curate. We just have to go find out what is there, what is good, and just give them the link. So when we make the class schedule, 1/3 of our classes are flipped class, 1/3 of our classes are case presentation, and 1/3 of our classes are still traditional lecture series. So for the 1/3 flipped class, we give them the link of either a YouTube video, either you can choose a YouTube video, or you can choose certain web pages by either the national or international ophthalmological societies. And now with Spotify and Apple Podcasts, you have lots of podcasts where they discuss from the teacher's perspective, they discuss from a student's perspective. We can even give them that link. And the big publication companies, they've realized that this generation is not going to read from the books. And with the success of Marrow and Prep, they have started venturing into these online apps and video courses. So our own director of academics has created this ophthalmology MD in DigiNerve. So, and it's time for us to embrace these sessions and give them these links, and so that they will prepare at their own space, at their own convenience, and come to the class for discussion. In the class, we have this discussion either by an MCQ-based discussion, or an Antakshari type discussion, or a scenario-based discussion. So the most common discussions that we do in the flipped class model is the MCQ-based discussion. The first and foremost thing is this is not a quiz. We are not going to conduct a quiz here. The questions are just to guide the moderator to further discussion. So usually we allow two residents to select or to prepare 20 questions that will cover the topic. And we use the Kahoot app, and more the multi-level questions or multiple response questions, the better the learning. So this is a small video of how we do it.
Good morning, everyone. Today we'll see, we have question neovascular glaucoma. Let's start. Pathogenesis of NVG include all except anyone from team B? Subhash.
The pathogenesis of NVG is characterized by inflammatory causes and an ischemic insult to the eye. So because of ischemia and inflammation, there is release of vascular endothelial growth factor and not pigment epithelial growth factor release. The VEGF release is usually the source is usually the Muller cells, which are the richest source of VEGF. Following VEGF release and also the inflammatory insult which is there can be increased vascular permeability, leukocyte adhesion to endothelial cell, and as well as endothelial cell mitosis. So along with these things, because of increased permeability, there can be friable new vessels which form, which cause the neovascularization of iris and angle leading to glaucoma.
This is also an opportunity for you to discuss. See, if you look at the answers, 3 of them have selected leukocyte adhesion to endothelial cell, and 6 of them have selected endothelial cell mitosis. You can ask them who have selected that why they feel that that is the right answer.
I try to rule out by exclusion. So A, B, A and D were quite sure they were the causative pathogenesis, but whether it was pigment epithelial or vascular epithelial or vascular epithelial growth factor or this leukocyte adhesion, that was I was doubtful. So I'm not.
Yes, ma'am. So any condition which causes retinal ischemia or hypoxia, which can lead to pro-angiogenic factors, which include VEGF and other factors like IGF and in IGF-1 and 2 and PDGF. So this can lead to increased vascular permeability, which can cause leaky vessels, and endothelial cell mitosis, which leads to new vessel formation, and leukocyte adhesion to endothelial cells, which causes blood-retinal barrier breakdown.
So these were the 3 options which were given. So there is increased vascular permeability and endothelial cell mitosis. And along with that, there is leukocyte activation. And these are all factors which will give rise to the formation of the new vessels. Okay.
So everything will lead to NVI or NVA, which will lead to a fibrovascular membrane and which will contract and finally goes to angle closure. Mechanism explaining NVG.
Okay, why do you think that anterior pulling mechanism? See that all 3 are very different mechanisms of glaucoma. All of the above every time is not the right answer. Okay, right. So anterior pulling mechanism. Anybody can elaborate? Ojas or next to him.
New vessels, the formation of the new
No,
vessels.
we're not talking about new vessels. What is the mechanism of glaucoma? Okay, so I agree with you that neovascular glaucoma can have an open angle glaucoma stage and an angle closure glaucoma stage. But when it presents in angle closure glaucoma stage, what would be the mechanism? Do you all agree that all 3, anterior pulling, posterior pushing, and pupillary block, all 3 can present with what? How will be the angles here? Yes, very good. Everybody is clear, no? All three will present with narrow angles. Okay. So the moment you see narrow angles, what will come in your mind? Refer to glaucoma. Okay. You will, anybody would think of, okay, I want to manage this patient, I'll give anti-glaucoma medications and I will do a PI, right? So angles are closed, we will do PI, right? So unless we understand the mechanism of glaucoma, you cannot justify your PI. Right. So that's why I want you to understand what is the mechanism of glaucoma here and whether YAG-PI will help in this situation or in which situations YAG-PI will actually help and YAG-PI does not have a role. Okay. So what do you think? Anterior pulling mechanism is the right answer. Now everybody knows. What is happening?
Good morning, everyone.
So in this, the two residents who do the teaching part, they retain at least 90% of the class after 2 weeks. And for the remaining students who are discussing, they will retain at least 50% of the knowledge at the end of 2 weeks. The disadvantages, one, we could not complete cover to cover. There were instances where we had made 20 questions and we had discussed only 5 questions in 1 hour. So identification of must-know topics and focusing on them in the initial 5 questions is very important. False positives, not everyone goes through those links and videos and comes. So for an MCQ, they just click the answer. But individual discussions prevents this aspect. The other part that we do for our fellows, where small groups of 4 to 5, we again give them a 40 or 50 minutes video for them to see that and then come for the class. During the class, we just randomly select one fellow who will discuss the first 10 minutes of the class. The second fellow will discuss the next 10 minutes of the class, and the third fellow will discuss the next 10 minutes of class. And based on these discussions, we can also have open-ended case discussions, and we can give them surgical videos to see and then discuss how to anticipate or manage certain situations. So for example, these are different ways a cornea can tear during trauma. So we'll just give them this image and ask them to mark how they will start the suturing, where they will start the suturing, which area they will start first, which area they will start late, they'll suture last, and we'll have the discussion on that. And we can also use this to teach soft skills with, again, Netflix and Amazon Prime. There are so many medical sitcoms and movies. I strongly recommend these two, Hospital Playlist and Scrubs. Hospital Playlist is a Korean sitcom, a bit idealistic, feel good series, just 2 seasons, 8 episodes each. But they talk, they have a lot of content on how to talk to patients, how to get consent, how to handle a difficult patient, how to explain prognosis. So you can just ask them to watch a episode of that, say season 1, episode 11, and then on the soft skill, during the soft skills class, we can discuss that situation. This is a very close, which is an important movie. This was shown to me during my UG, the pharmacology department, my pharmacology department showed this. This is a movie on L-DOPA for encephalitis-induced Parkinson's. So they showed this movie in the class and they discussed how to get consent for a drug trial, how to talk about the pros and cons of a new drug, and what are the effects of Parkinson, or how does L-DOPA work. So we can use these medium also for teaching. Thank you.